The greater wing of the sphenoid bone, or we can say the alle sphenoid, is a bony process of the sphenoid bone. There is one on each side, extending from the side of the body of the sphenoid and curving upward, laterally, and backward. Now they have four surfaces: the cerebral surface, next we have the lateral surface, then the orbital surface, and at last we have the maxillary surface. Now the cerebral surface consists of three major parts. Firstly, we have the foramen rotundum, which transmits the maxillary nerve. Secondly, we have the foramen ovale, which allows the passage of the mandibular nerve and accessory meningeal artery. And thirdly, we have the foramen spinosum, that is traversed by the middle meningeal vessels and the spinous nerve. So the posterior part of each projects as a triangular process which fits into the angle between the squama and the petrous portion of the temporal bone, and it presents at its apex a downwardly directed process which we call the spina angularis and the sphenoidal spine. It serves as the origin for the sphenomandibular ligament. Next we have the lateral surface. Now this is a horizontal ridge which has the infratemporal crust dividing it into two surfaces, upper and lower. The upper surface is also called the temporal surface and the lower surface is known as the infratemporal surface. The foramen spinosum and the foramen ovale are pierced into this surface. So we talked about the cerebral and the lateral surface. Now we'll move forward towards the orbital surface of the sphenoid bone. Now we'll move forward to the orbital surface of the greater wing, which is smooth and quadrilateral in shape, and it is directed forward and medially, and it also forms the posterior part of the lateral wall of the orbit. At last, we have the maxillary surface of the greater wing. The maxillary surface faces anteriorly and it forms the posterior border of the pterygoid fossa. Here is just a glimpse. We will talk about this fossa in detail in the next section. Now another interesting thing to tell you guys is that the lateral half of the greater wing of the sphenoid bone articulates with the petrous part of the temporal bone by a synchondrosis. And between these two bones on the undersurface of the skull, we see a furrow, which we call the sulcus of the auditory tubule, for the lodgement of the cartilaginous part of the auditory tube. Now we'll talk about the borders of the greater wing, which are frontal, parietal, zygomatic, and squamous. Now, as the name given to these borders, the greater wing makes the posterior lateral margin with the squamous part of the temporal bone, calling it the squamous border. Secondly, it makes the anterior medial border with the zygomatic bone, and we call it the zygomatic border. Thirdly, it builds a posterior medial border, which we call the frontal border. And at last, we have the parietal border, which is made superiorly with the parietal bone. So now we'll move on to the lesser wing of the sphenoid bone.